One of our patients just had a baby and we had no idea she was pregnant.
Okay, is the baby
We were not
out?
prepared for that.
On an early December morning in 2018, a 29-year-old woman at a healthcare facility in Arizona gave birth to a healthy baby boy. However, the arrival of the child was unexpected to say the least, as the mother was in a vegetative state and had been intermittently for 26 years. The birth and the story that followed sparked global outrage, and only now, 5 years on, has the body cam footage from that incident been published. So what led to a woman in a vegetative state, in a private nursing facility, being impregnated without anyone knowing right up until the birth? And was this a wake-up call on how vulnerable people in long-term care are at higher risk of sexual assaults? Just a warning, this case is extremely disturbing, with detailed mentions of sexual abuse and assault. On December 29, 2018, law enforcement were called to Pasadena Healthcare, an adult private care facility in Phoenix, Arizona, after a patient there went into labor. The woman in question had been there since 1992. Now that is 26 years. Admitted at just 3 years old, she was nonverbal and was intellectually and physically disabled due to lifelong implications caused by childhood seizures. The seizures affected her motor and cognitive functions, including loss of functional use of her limbs and her speech. She had been in and out of a coma for the majority of her time at Pasadena. She had a very limited ability to move her head and her neck and was capable of making small facial gestures in response to stimuli. However, she couldn't form any intelligible dialogue, meaning she was in absolutely no position to consent to sexual intercourse at any time, in any way, during any period of her life. So when nurses tended to her bedside the morning of December 29th as part of their daily rounds and discovered she was crowning, it was far from a miracle, rather a living nightmare. A source told KTVK that the victim had allegedly been moaning in discomfort that day, and then when one of the nurses went into her room to change her pad, she, quote, saw the baby coming. All visitations had to be approved and they had to sign in on arrival, and again, the victim was only allowed female caregivers, so there was no obvious miscreant. So who could have raped and impregnated this woman right under the noses of her family and the staff? Immediately following the incident, a formal rape investigation was opened. In documents filed in May of 2019, the victim's attorney, John Michaels, cited a medical exam conducted on the day of the birth, which alleged that this wasn't the first time she had been sexually abused, and she may have suffered from multiple sexual assaults. Investigators latterly obtained a search warrant to oblige all male staffers to provide a DNA sample, and among them was 36-year-old nurse Nathan Sutherland. Sutherland had been a licensed nurse for over a decade and had worked at Pasadena for almost 7 years.